Hi, I'm Siobhan. So my experience with healthcare in the United States is that I am the daughter of a soldier who's served in almost every conflict since 1991 that the U.S. has been a part of. And I was really spoiled because I had access to TRICARE my whole life, which essentially, if you're living on or near a military base, you walk onto base with your ID in hand, your military ID, you go to a hospital and you're like, I have this ailment or whatever issue, and it's solved right then and there in the hospital, and then you're given your free prescriptions at the end of it, or very, very low cost prescriptions. There's nothing that ever comes at over $20 if I remember correctly. So I was very spoiled with access to a hospital and every single doctor I could need and get anything resolved within probably 12 hours at the most. When I turned 26, which in the United States, I think for everybody, is when you can no longer be under your parents' health insurance. You have to start your own plan. I was a non-traditional worker. I'm an actress and a teaching artist. And so I didn't have a company that was like, here, let me subsidize your health care. I just had to figure it out on my own. And when I went to look at different health companies, it was like $500 a month for the equivalent of what I had been receiving my whole life. And I was not in a position to be spending an additional $500 a month on healthcare, so I just didn't do it. I was uninsured. And of course, not that long after being uninsured, I ended up having an allergic reaction to lobster, which I found out I had a shellfish allergy. Had no idea until that moment at that very nice French restaurant. So I ended up in a private hospital because I also didn't know there's a difference in the States between public and private hospitals and the rate of costs by attending such a hospital. So I ended up at a private hospital with a $2,400 bill for saving my life, which, thank you, didn't know my life was worth $2,400 at the time. So that bill was astronomical for me at that point, and I was like, okay, I've got to get on a payment plan or like apply for a grant to figure out how to pay for it. And then fast forward to when I was about, I guess, 27, when Obamacare came into effect and was required to have health insurance. I applied. It was cost effective. They actually took into account how much money I didn't make per year and the fact that it varied. And so I had pretty great insurance through Obamacare. And of course, I was playing volleyball with my friends. Somebody had shellfish on their hands because all I knew, all of a sudden, my eyes had swollen shut. I was all puffy, and my friends were like, maybe we should take you to an ER. I was like, I think that's a good idea. So we drove to a hospital and made them find a public one because I knew there would be a difference in costs. Went to the public hospital, was treated for my allergic reaction, and I believe I ended up paying a whopping $25. I love what I do for a living. I love teaching. I love acting. And it's kind of crazy that this current government wants to punish me for living my dreams by saying, great, you can't be insured because you don't work for a company that offers insurance. Or if I do want insurance, it's going to cost me more than my monthly rent, which, living in New York City, that's kind of a ridiculous statement in and of itself. And yeah, also my dad's a soldier. Like, haven't I given enough to this country by letting him walk out the door my whole life and hoping he would return when he'd come back from Iraq and Afghanistan? It's kind of like crazy how difficult it is to have health insurance for someone who's gone through all that.